And then these are some of the components that work for successful treatment. You know, good education for parents and kids about the symptoms, about the course, and about, you know, the more information you have, the better manager, you know, parents, kids, teachers, you know, the community can be in terms of what's needed. Behavioral treatment is an extremely important component, and that combined with the next two, medication management and medication and behavioral treatment together. That when you actually add all of those components plus getting good educational support, you're talking about extremely effective, you know, very good treatment that allows, you know, children and adolescents and adults to, you know, function extremely well in their day-to-day life. Okay. I came to the Mind Institute with my husband to work with Dr. Julie Schweitzer, who is currently conducting an MRI study. Well, actually, she has multiple studies going on, looking at the different subtypes of ADHD. And she is specifically examining what regions of the brain are responsible for cognitive control. And she's looking at, you know, typically developing children and adolescents, as well as children and adolescents who have already been diagnosed with ADHD. And I am not a neuroimager, and so I'm going to try to explain my one slide, and I think our junior specialist on our research project is here, so you can help me if I don't get it right. Okay. One of the things that Dan talked about before was memory and working memory. And working memory is the idea of sort of trying to remember a telephone number while you're also doing another task. And that's what we have to do all the time. And for children and adults who are trying to manage ADHD, those are the kinds of things that they're having difficulty integrating. It's like, okay, I've got to do this thing and this other thing at the same time. And what this slide shows are for typically developing, you know, kids, teens, and adults. This part of the brain, the frontal lobes, you know, that's like the conductor of your orchestra. Like if you think of your brain is an orchestra, the frontal lobes, that's the conductor. Okay, so for people who are developing, you know, typically and have good frontal lobe functioning, they're using those regions you know, pretty effectively. They're using language to help mediate and organize any task that they need to do. For people who have ADHD challenges, they're using a different part of their brain. They tend to use more motor areas and more visual areas to try and perform the same functions, and it ends up being not quite as efficient. And so this research is trying to figure out you know, the differences between the groups, but also trying to think about, okay, in terms of interventions, what things might be more helpful for people who've got different types of brain functioning, you know, what kinds of things might be helpful in the real world. So that was the quick version. I've got information about our research project. That's the contact info. There are also sheets in the back. And our catchment area covers both Sacramento and Davis. And we're looking for teens and adolescents, both who are typically developing or who maybe have some ADHD challenges. And I'll just show you a really cool thing, is that for any child or adolescent who's in our study, they get an fMRI picture of their brain, so you get your own personalized T-shirt.
Your brain.
So sorry, that was so fast, but that was the quick version. Thank you.